Welcome to Counterpunch. Today's topic: should the U.S. adopt a single-payer system for health care?
Yes, the U.S. should adopt a single-payer health care system. It won't be easy to get past the misinformation and fear-mongering on this issue, but we'll eventually come around to single-payer because it's the only way to control the skyrocketing cost of health care. Right now, 31% of every health care dollar goes toward the private insurance bureaucracy and the associated mountains of paperwork. In a single-payer system, delivery of care, doctors, clinics, hospitals, and so forth, remains largely private, but payment is handled by a single public or quasi-public agency. Patients still get to choose their doctors and hospitals, but doctors go back to practicing medicine instead of tracking insurance codes and filling out forms. The insurance middleman would be eliminated, and we'd save about $400 billion a year. This is not socialized medicine. It's more like Medicare for all. For Left in Alabama, I'm Sherry Walker.
Absolutely not. The appeal of a government-run single-payer system is that medical care is free for all. Of course, it's not free, as we all pay for it with increased taxes, but because we wouldn't pay anything at time of service, then it looks free. And that's enough, for those ignorant of TANSTAFL. There ain't no such thing as a free lunch. That is nowhere truer than with a single-payer healthcare system. Let's not deal with theory, because we can look at Canada and Great Britain to see what happens when a nation-state adopts such a system. First, taxes increase dramatically. Second, as time passes, government expenses rise explosively, leading directly to lower quality care, long waiting times for tests and treatments that we now take for granted, and of course rationing, denying the elderly and terminally ill medical care that can go to healthier individuals. As last year's scandal revealed, Great Britain actually has death panels, denying treatment to the sick and elderly. As for Canada, well, the Premier of Newfoundland decided to get his critical heart surgery done here in the U.S. As things get worse, both countries are turning back to privately provided medical services. It makes no sense for us to abandon what works and embrace what other nations are now realizing doesn't work. For Politics Alabama, I am Matthew Givens. Produced by Politics Alabama. Online at politicsalabama.blogspot.com.